Hello everyone, thank you so much for watching this video on chasing that pancreatic tail. When I started doing ultrasound, the hardest organ for me to find in the abdomen was the pancreas, let alone the pancreatic tail. When I worked with several students, it was sort of the same, I kind of saw the same in that it was hard for students to find the pancreas. And it is mainly because, as we all know, the pancreas doesn't have a nice capsule, like for example the kidney or the liver, and it's not that big either. And so we have to rely on those vascular landmarks, those vessels that are in the area of the pancreas that help us find it and also delineate the different parts of the pancreas. Adjusting to something like that, to look for something that is adjacent to, may be difficult especially when we're used to looking for the actual target as opposed to what's next to the target. And so I remember seeing students and novice sonographers struggling also at finding them. With time, of course, you get better at it, and then it becomes more automatic, looking for the splenic vein, looking for the IVC, for the SMA, for the SMV, for the portal confluence, and things like that. But those landmarks help us a lot for the head, the neck, and the body, and of course sometimes for the tail, and I'm talking about the splenic vein. But in some patients, the tail end is not well visible from the anterior window, and so even though we see the splenic vein, we may not see all the extension, the entire extension of the tail. And so something that may be useful that I would like to share with you is to use the spleen as a window to look for that pancreatic tail. As you know, the pancreatic tail travels parallel to the splenic vein towards the splenic hilum. And so if we look for the pancreatic tail at the splenic hilum, we should be able to see it. But here are a few tips. So first of all, when you're scanning the pancreas, make sure that from the anterior window, that is at the start of the examination, if you do the pancreas at the start, but obviously I'm assuming that you will be looking at the pancreas from the anterior window first. So when you find the pancreas, when you find the head, the body, the neck, make sure you remember the echogenicity of that pancreas. Was it isoechoic, hypoechoic, or perhaps echogenic? Because then, by knowing the echogenicity of the majority of the pancreas, you can use that information to identify the tail when you're looking at it from the left side, from using the splenic window. So important to keep that in mind. And once you decide to look for the tail using this approach that I'm explaining here, try to for the window, where to place the transducer. I mean, I'm pretty sure you all know how to find the spleen, but for those of you who perhaps are starting or don't have a lot of experience, if you draw an imaginary line from the xiphoid process, so right in the midline, and you draw that imaginary line all the way to the patient's left flank, so to the patient's left side, and the line is almost reaching the stretcher, Okay, so basically you're drawing a line pretty much to the left flank posterior aspect. So your scanning hand will almost be touching the knuckles of your hand will almost be touching the patient's stretcher, right? So again, that's the window for the spleen. So we're going to be using the same window. You place a probe there, intercostal, of course. So make sure you are in between the ribs, in between the two rib shadows. And then you're going to be looking for the hilum and the splenic vein, either one, and so that should help you find the tail. So the tail will be pretty much adjacent to those two structures. Sometimes you will have to do some sweeping through the area. And again, this is where the information about the echogenicity of the pancreas from before comes in handy, because you're trying to look for a tissue with the shape of the tail, right? So it's going to be almost like an inverse tongue-like structure. And you're looking for an area of the same echogenicity as you saw before for the head, for the neck, and for the body. And perhaps even a little bit of the tail, not the most distal portion of the tail. So you do that, and then as you're sweeping through, you should be able to identify it. Something else that helps me is also increasing the contrast to localize the pancreatic tail. You've seen in my other videos that I rely heavily on changing the dynamic range and changing the contrast. And in this case, it's the same. And so you can change the contrast by a lot. And then once you identify the tail, you can bring it back to the more acceptable level, right? To make it more diagnostic. So here are some images that I want to show you exemplifying what I was explaining. So as you can see on those images, you notice the presence of the spleen, the presence of the splenic hilum, in some of them the presence of the splenic vein, and then the tail being identified. Like with everything else, initially to get used to this, it may take some time, but my suggestion is try to incorporate it or try to practice it as much as you can. If you do abdominal imaging, well, full abdomens, you're going to have to look at the spleen anyway. And so that's a great time to, after you're done with the spleen, then take a look and look for the pancreatic tail. Initially, if you don't feel very confident about it, you don't have to take images, but eventually you will. The thing is also, even if you're not able to identify the pancreatic tail, if there was an abnormality in the tail, let's say a pseudocyst or some type of mass, you would be able to identify it if you know how to look for the pancreatic tail in that region, right? So practicing using that window and practicing getting your eyes used to looking for the tail in that area will give you the benefit to look for that, for pathologies, or to recognize pathologies. Of course, there could be adrenal masses too that may mimic the presence of a pancreatic tail mass. But of course, we have to also go by the exact location. You're going to be looking at the upper pole of the left kidney, right, to see if it's being pushed by this adrenal mass. You also have to look at the patient history, of course. So there are other things that will help you narrow it down. But even if you're not able to narrow it down, the fact that you were able to find something there, that's a huge advantage right away, right? You were able to find something, and perhaps the patient will require further imaging to get to the actual differential diagnosis, but you were able to find it, right? That's a huge step, as opposed to not seeing it at all, and then everything ends there for the patient in terms of further diagnosis. Okay, so then basically, I hope I just wanted to explain this this way to look for the pancreatic tail. So hopefully you find it useful, practice it, incorporate it in your repertoire of scanning techniques. And if you happen to, if you want, after trying it for a few times and you find it useful, maybe come back and leave a comment below and share with others what has worked and how it worked for you, or if it didn't work. You know, it's not for everyone, of course, and actually it doesn't work for all the cases. As you know, sometimes if you see the tail beautifully from the anterior window, or if the patient is a difficult vis, then no matter what we do, it will be difficult. But again, it's just another window to have in mind. And basically, you already used the window, like I said, for the spleen, but it's just a matter of now training your eyes to look at that area adjacent to the splenic vein and the hilum, so that you can look for that pancreatic tail. Well, there you go. Thank you so much for watching this, and feel free to share with other colleagues if you find this video useful. Thanks again, and see you next time.